tools would help embed the capability statement. So 0% self-evaluation, 22% supervision tools, 54% training, learning and development sessions, 15% web-based learning and training, 9% team organisational assessments. It'd be really interesting around the training and learning development sessions. Those of you who selected that answer, what sort of training would you be thinking of? What would be helpful? You know, are webinars like this evening helpful? Do you prefer face-to-face training? Is it around reading and reflection that you can do at home? Okay, any other comments on the poll, Godfrey?
The last point you mentioned, the last folder about how this would be used in practice, I think it was. I think that was. Yeah, it was, for me, it's really encouraging for colleagues to think that this capability statement has the potential to be used in all aspects of practice, not in one particular way. And indeed, the idea behind the triangle is to think of, capabilities in quite a more multifaceted way, as requiring more than just knowledge or more than just skills. It's actually, you need all those three together, and is relevant for actually working holistically with people with lived experience.
Absolutely. And as we mentioned before, social workers may be based in a wide range of teams, sort of within a local authority, a trust, or within the voluntary sector. So how these statements can be used in all areas of practice.
Yeah, absolutely.
So we're getting to the point where we're ready to take questions, to have a discussion about any of the ideas which have been shared. We've already got some questions coming through. So we've touched upon this one, but shall we kick off with, how does the capability statement reflect the PCF?
It's a very good question. Thank you very much. I think in one of the slides I spoke about it, perhaps thinking about social work practice with adults with learning disability as perhaps requiring distinct knowledge and skills, by which we can see through the eyes of the PCF. So for instance, if you take the PCF domain around knowledge, that's quite a broad category. So we can think of the capability statement as almost like a funnel. You take the PCF at the top as the broad category, and then the capability statement gives you much more discrete and specific knowledge about what you need to practice with people with lived experience. So I think that's how it's related. We're taking from the broad to the specific, which is what the capability statement does. And in other respects, the capability statement, as Becky, you mentioned, takes us in new directions in social work practice, because it highlights quite clearly the need for social workers to think of health inequalities as enshrined in their role. Although we've thought about it implicitly around values, around rights, and around justice, say PCF domain 2, this capability statement is actually pushing us to think about it in more concrete terms, that we need specific skills to be able to address the specific issue of health inequalities that gets manifested so starkly in the lives of people with lived experience. So issues around specialist advocacy, for instance, not only that, but actually having specialist knowledge about how particular forms of health inequality play out in people's lives, for instance, around increased mortality. That then also means that we need more understanding about, end-of-life care, for instance, which has not always been apparent as one of the knowledge and skills that we require to work with adults with learning disability. The capability statement highlights that as relevant, because the literature review clearly shows that increased mortality is part of the lived experience of people, of adults with learning disabilities. So I think the capability statement potentially pushes us in new directions and tells us to look at new areas which may not be so readily apparent with the PCF.
I think the other thing we need to think about is that there are a number of capability statements. So we've already got the capability statement for social work with older people. We're developing the social work statement for social work with autistic adults, and about how we ensure we use them all in practice at the right time, which may differ for each social worker depending on their role, depending on who they're supporting at any one time. The next question that's come through is about how can this be applied to generic social work teams?
And that's a really relevant question, and we can use a scenario of our experience of testing out the draft capability statement with some social workers in a part of England, and that service had moved from being a specialist service to a generic role. So some of the social workers who consider themselves to be generic adult social workers were now being allocated to work with people with lived experience. And their question to us was, well, this is a new area of practice for me. How do I do this? Well, the capability statement provides a ready-made answer because it highlights the specific skills and knowledge, as well as the values that one needs to practice in this area. So I think for both generic and specialist teams, it's relevant, principally because it highlights what one needs to know in learning disability specifically.
My background before coming to BASW was on an emergency duty team, so obviously dealing with a wide variety of situations out of hours. So one of the things I've thought about is about how this statement could be used by EDT workers out of hours. And I've come back to that if we're looking at knowledge, skills and values in different areas of practice, for a team such as the emergency duty team, it's important, it's in some ways even more important to make sure that we're looking at the knowledge, skills and values in different areas of practice and how they can differ to make sure that people are equipped to deal with whatever crisis may come out of hours. Because there can be such a variation of situations, it's even more important.
Absolutely. And Becky, whilst you were talking, I recall some of the findings from the survey and also the interviews that we've done with social workers, where social workers have told us that they don't think that the university degree equipped them for practice with adults with learning disability. And then we reflected on the fact that actually perhaps some of the university curricula don't address the particular needs of people with lived experience of learning disability. The capability statement therefore also enables us to address that particular gap in social work qualifying programs, because again it highlights the specific knowledge that social workers have told us is required for effective practice in that in that particular practice area.
The next question that's come through is, where is the consideration of the need for social workers to be capable at partnership and service community development? I believe this is crucial for us to reach out to other realms that might impact upon the lives of people with learning disability.
Yes, and I think that is an excellent point. And I hinted at that earlier on in my presentation when I presented some data from the Learning Disabilities Health Observatory. And I spoke about the number of people at 950,000 known to be living in the community. However, 124,000 of them receiving services. So there's a huge gap there. So the question, therefore, that arises for social work is if there are increasingly more people living in the community, but fewer of them are getting services, how do we have those practice skills to enable people draw on the strengths within their community to live independent, fulfilling, and safe lives, and also to enjoy all the, these issues are also matters of human rights. People with lived experience have absolutely the same rights to family life, the same rights to social life, the same rights to make unwise decisions as all of us have. And so, how do we as social workers enable people to live those lives in the community when perhaps not all of them may be known to social work teams? So it calls for us to think about social work in different ways, and it calls for us to think about different skill sets to address those particular issues.
I think when we're talking about partnerships as well, we're talking about partnerships with other professionals. So when we mentioned before about continuing healthcare, that's one area that we need to look at partnerships. But we know as well, the lessons that we've learned from integration about us being clear as social workers about what the social worker role is and how we're able to articulate that to our multi-agency colleagues. One of the findings that we didn't touch upon before was around how social workers feel about professional leadership. And within the survey, it scored quite low in terms of the knowledge and skills that social workers need to have. I think that's really interesting around how we see ourselves, whether we see ourselves as leaders. So that may be a leader within a team, within a multi-agency group supporting a person, or a leader at more sort of a management practice lead level. But that's really important when we're talking about partnerships and developing services and community.
Yeah, and Becky, one point I wanted to add to that is when you showed the triangle, you showed how the different strands of knowledge plot onto different sides of the triangle, and you highlighted that there were detailed information behind those points. And one of that detailed information is around the explanation about the context of learning disability services. And the document, the capability statement will explain that the context of current learning disability services is that it's multi-agency. It's likely to be integrated, even where it's people are not known to statutory learning disability services. They are likely to be working with a range of professionals. They're likely to be working with GPs, for instance. They'll be known to housing services. Perhaps they will even be working with people around their welfare benefits, around their legal rights. So in that sense, it's a number of professionals are involved, and therefore one needs those skills to work in partnership with them.
We've got lots of comments and feedback coming through, but please send more from home. Any thoughts you've had throughout the webinar, any questions or feedback you'd like to share. Again, if anybody wants to join us, raise your virtual hand and we can bring you in through audio so we can have more of a conversation, or use the chat box in front of you. Okay, so we've got some comments about how participants would like the capability statement to be integrated into practice. So somebody's fed back that they agree learning Makaton helps with everyday work. That's really interesting. It would be interesting how teams use Makaton at the moment and how available sort of services are around that. We've got that webinars and face-to-face training would be most beneficial. Combination, but webinars would be useful. I prefer face-to-face training for well-trained facilitators. Webinars that all people can attend, I think, would be the best way to support it to be embedded. Everybody has a responsibility, from senior managers to workers, to attend to help their practice. Training that involves people learning together is needed most of all, absolutely. And training face-to-face at first, and then tools to cascade through team training and supervision to reinforce. Okay. Got a comment around, I found that even other social workers, such as generic social workers, lack basic understanding about people with learning disabilities. All social workers would benefit from training in this area, no matter where they work.
Indeed.
And there's something there about how we share our knowledge as social workers. So where you may be a social worker, working with adults who have learning disabilities on a day-to-day basis, how that knowledge could be shared throughout an organisation.
Indeed. And that's perhaps leads into the professional leadership role, which you mentioned earlier on, that scores quite low within the survey. But we've spoken about how the capability statement maps onto the PCF, or it's seen. It can be seen through the prism of the PCF. The PCF also talks about professional leadership. So perhaps that makes it incumbent on us all to engage in mutual learning with our colleagues who may not have the expertise.
So just on that, we've had another comment say, absolutely, professional leadership is important. How do we work with people with learning disabilities who are known to us, as well as those who are not known to us, and families and service support workers and communities to get them to create opportunities? These are the people who will most often be the people who engage with people with learning disabilities rather than us.
Indeed, and on again, one of the points on the triangle that Becky you showed was the findings that people with learning disability, adults classified as learning disability, wanted social workers to be accountable for the work that they do. And by accountability, they were saying that one way of working well with us, making a positive impact on our lives, is really to own up when errors are made, and also the responsibility on social workers to seek managerial support and case direction where issues seem to be really complex and also intractable. So that's one point about people working with people with lived experience that we found. Then the other point, which I thought, Becky, you mentioned, which I thought was really interesting from our discussion with people with lived experience, is the conception of relationship-based practice. They told us that, look, we know you social workers are busy, right? And we know that social workers have to leave their roles, there's huge staff turnover. We understand that. But we need social workers who have the skills in developing and maintaining relationships. We need social workers who have the skills in repairing relationships, because relationships with us tends to fracture because people leave sometimes without telling us. And sometimes as a person with lived experience, you in your home and someone comes to visit you for the first time and say your previous social worker has left. So relationship-based practice was sort of defined in quite a multi-dimensional way, and I think it has really serious implications for us about how we work with people with lived experience, and the capability statement addresses that in detail.
Okay, the next question is really interesting. The local authority I work in has recently merged learning disability teams with generic adult social care. The expectation is now all social workers work with all people and specialisms are being diluted. Do you think this is a mistake?
So it's a really interesting question. And I'm answering this not because I'm taking the politician route, but I genuinely think that the answer to this is quite complex, because I think seeing this through the specialist or the generic continuum polarization, I don't think it's necessarily helpful. I think that we have professionals who require distinct sets of knowledge and skills to work with a distinct group of people. So if we take it, for instance, issue around mental capacity, Becky, which we've spoken at length about. If you take an issue with like mental capacity, how that manifests in a generic service with, say, an adult who a substance, a drug and alcohol misuse service, how that manifests in that area of practice will be really quite different from how it manifests from working with people with lived experience of learning disability. So I think it's much more about the specific skills to work with a specific group of people. And I also think that there are two separate issues. There's one issue around what skills that you need, and then there's the other more contentious question and debate about, is this a specialist area of practice or is this a generic way of practice? So that's how I will tend to see that question, and I don't know whether it's wrong or right.
I was thinking about it from a perspective of how the capability statement could support in that situation. So where a social worker may move from a team that only works with adults with learning disabilities or only works with older people, moving into a more sort of generic adult social care team, or vice versa. Actually, how the capability statement could be a really helpful tool in terms of bringing teams together, sharing learning across the teams, and actually developing the knowledge of newly formed teams.
Yeah.
I think that's a really good example of a time that this capability statement could be crucial to impacting on social work.
Indeed. And actually, from the strategic level, it may be that managers decide that the specific needs of that particular area requires a separate structure to deliver services for people with lived experience. So it's quite difficult to sort of answer yes or no as right in all circumstances. I think one has to take some particular issues into account.
I think that's perhaps one of the learning from the projects, which we all already knew. Services are different in different authorities, structured differently, funded differently. But when you sit down and talk to social workers about how different social work practice can be depending on the structure of the team and the structure of the organisation, again, the capability statement can really support us through those processes. Okay, we've had a couple of comments around the Mental Capacity Act, which I think is at the front of all our minds currently with all the changes. So I wonder if professional leadership becomes more relevant in generic teams. I think we're often role models to our multidisciplinary team. For example, modelling the Mental Capacity Act use to primary care colleagues. Okay. And then I would welcome ongoing training on the Mental Capacity Act.
Okay, great. And if you allow me, a colleague who asked that question, I think this is an opportunity for us to say a bit more about mental capacity, because it's topical, but also because I think it has particular resonance for discussions around human rights of people with lived experience of learning disability. So as far back as 2008, the House of Lords Joint Committee on Human Rights wrote quite an important piece of document stating that they believe that people with lived experience of learning disability were particularly vulnerable to human rights abuses. And I think mental capacity puts us at the forefront of those discussions, because it really brings into sharp focus that discussions about, well, the care and control role of social workers. You know, how much do we empower people to take positive risks, as part of their human rights, at the same time as we have statutory duties around safeguarding, at the same time that the state has a duty to protect the rights of people. So mental capacity, I think, really is emblematic of some of the tensions, or some of the debates, or some of the fine judgments that social workers need to make around human rights and the needs of people with adults with learning disability.
Brilliant. We've got lots of comments coming in around the generic specialist experience. So we'll try and take them all together and then come back to the other questions that have come through. So keep sending them on through. So I feel it would be beneficial if training also involved adults with learning disabilities, as my team is mixed with generic adult social care, and people who are generally given generic adult social care will refuse or have a look of fear when there is a case when someone has a diagnosis of learning disability. Okay, and then another comment, I worked in a specialist learning disability social work team for many years until the local authority restructured in favour of generic teams. In the generic team, social workers were extremely worried about their lack of knowledge and experience of working with people with learning disabilities, and felt that managers and team managers expected them to be experts immediately. When there was so much to learn about different disabilities, so many different types of learning disability, as well as people with dual diagnosis.
And Becky, can I make a comment about that? And I think it's really interesting, those comments, because two things. When we've spoken to colleagues in the sector about the capability statement, we have been told it's been received with open arms, and it's believed that this is a framework which is needed in social work. So that's one side. The second side of it is when we do surveys, when we've done the surveys and we've also done interviews with practitioners within those services believe that some specialist knowledge and skills are required to be able to make positive impact on the lives of people with lived experience. So it's quite instructive how that debate around genericism and specialism plays out, because those who work within those teams would say, if not necessarily specialist knowledge, certainly specific pieces of knowledge and skills are required. But maybe it actually comes from, if you work in a particular area, you develop more practice wisdom, don't you? By virtue of working in that area, and then in some respects, there's some skills that are derived and gained from the actual doing and being engaging in that area of practice as well.
Okay, here's a comment. People with learning disabilities often have much bigger packages of support. Working in generic teams can often bring social workers at odds with managers who don't appreciate the bigger packages. In specialised teams, I've found management is much more accepting of these people who often have more need for support and often bigger packages of care.
We don't, I don't know whether what I can say specifically about that, but in terms of the evidence of research, of the evidence about spending on learning disability services, interestingly, when we had our experts conference on this on the 26th of February, Professor Chris Hutton from Lancaster University presented evidence that spending on local authorities have endeavoured to protect spending on learning disability services. Right, so they've not been capped. However, spending has not kept pace with demand. So it's quite interesting how that then might impact on people's understanding of the size of packages, so to speak, that people with learning disability required to meet their needs. But ultimately, it comes down to a matter of human rights, doesn't it? Unfortunately, we're having to contend with austerity. But really, these are what people need to fulfill decent lives.
We've had another comment through that echoes that experience, really. My experience of adopting generic social work teams is surprise from people who were previously older people, social workers with older people at the higher level of resource that their colleagues from learning disability services have had in building care plans. So a similar challenge around when teams come together about how cultures and processes need to merge and to form that new culture.
And we did find that in one of the testing, when we tested the capability statement, and social workers were telling us that one of the tensions in moving from specialist to generic is that if your manager comes from a generic background, they don't have a clear understanding of, for instance, the time scale that one requires to do a particular piece of work. For instance, the time that you would require to conduct a capacity assessment with a person with lived experience might be quite different from, what's the time that you require to do an assessment with someone who may not have cognitive impairment. So I think, again, perhaps we're talking about the skills of social workers in terms of capabilities, whether generic or specialist, but we need to think about the skills of senior managers as well, and actually the organizations and how they can support them.
We've had a few comments through about people thinking about how they're going to use the capability statement. These are really great ideas. So we've had one comment saying that the participants currently working with the Learning Disability nursing team and trying to organise some events in Learning Disability Awareness Week. And they're planning to arrange a social worker forum focused on learning disability, including the capability statements.
That makes me very excited. It makes us very excited.
And another comment about how the capability statement can be used within a generic team to raise the profile and to share learning. So these are great. If there's anything we can support with around that, our contact details have been shared, but if you get in contact during the project. We've had a number of other comments. So one comment's come in to say, I work with families of people who have a learning disability and would be interested in the results of the survey completed by carers. Also, will the capability statement look at knowledge and skills around understanding and balancing the needs of persons with lived experience of learning disability and the carer?
Yes, and one, again, Beck, as you know, one of the findings from our engagement with social workers and also people with lived experience, the picture they painted of current contemporary learning disability services is complexity around actually people with lived experience also being carers for their older family members. People with lived experience, perhaps also sharing joint tenancy with people with their family members who care for them. So that we need to perhaps we need to think about interdependency between people with lived experience and their family, and how we can work with the family as a holistic unit rather than sort of the individual alone.
Okay, brilliant. The findings will all be shared at a later date. So the findings from the carer survey will be accessible if that's something that you're interested in following up with us. We've had a comment about, I think this was when we asked for, is there anything missing, anything that you can't see? Obviously on the basis that there's descriptions behind just those headers that are shared. So a comment that I was really surprised that behaviour management and understanding of behaviour as communication wasn't featured in specialist knowledge.
Point absolutely taken. We are aware that social workers in part of behavior management is their role, but that itself really pushes us to think perhaps critically about the social worker role. Then that notion of behavior management itself, who needs to manage the behavior and why? And why is it that we're not able, that services are not available, or we're not able to put in place care packages which really follow the least restrictive principle, so that we do not have to engage in behavior management? Perhaps an empowering approach might be one way to think about this.
Okay, a few more questions coming through. We've only got a few minutes left, so if there's anything that you want to ask, please send it on through. Okay, so a general comment here that I think we must also acknowledge that just because someone has a learning disability doesn't automatically mean they want or need to be involved with a social worker.
Indeed.
Absolutely.
Indeed.
Also, I think it's important to involve people with disabilities in any training. If you want to know how you can help support them, ask them. I think that's a brilliant message for us all to think about taking away from this webinar tonight. Okay, so further question. Is there a positive impact on spending on older people's packages when social workers see learning disability packages? So I think the question is around when people see how big a package may be for somebody with a learning disability, could that have a positive impact on care packages for older people?
I think if we're going by the principle of a needs-led assessment, then I tend to think that it's really what it's a person's needs which determines the size of a care package. And in some respects, I mean, I tend to think that sometimes social workers, I know we cannot avoid it at all because of the funding panels that we need to go to and so forth. But I tend to think that in some respects, those financial packages shouldn't be so much our concern as much as the needs of the person and how we can identify them. And then it's up to, managers and other professions how those needs can be addressed if we're following the principles of a needs-led assessment and also some of the person-centered approaches that we've been talking about.
Okay, a comment here. So working in strengths-based approaches is not new in social work with adults who have learning disabilities. So I think generic teams can learn a lot from the approaches which have been used in social work with adults who have learning disabilities. We're now changing the approach of our home care services to be modelled on a person-centred model of support so that older people are offered similar opportunities. So that links back to the question earlier about generic teams or specialist teams and how that sharing of knowledge and approaches has had a really positive outcome. And thank you for sharing that.
Yeah.
Okay. A comment about, as an independent social worker running a support provider service for adults with learning disabilities, I think it is important that colleagues in statutory services should remember to use our expertise and knowledge. There are a huge number of high quality support providers around with a wealth of experience. That's great. As I mentioned before, we're coming to draw into a close. We've had a question through about how to join the upcoming webinar around the capability statement for older people. So that webinar is actually being run by our colleagues over at RITFA, Research in Practice for Adults. So you can book on that webinar through their website. I mentioned previously about different ways to still become involved in the project, and we'd urge you to do so, to make contact, to send your feedback through about the webinar tonight, but to think about joining the new project around social work with autistic adults, and there's a focus group being held at the end of March. We've got World Social Work Day celebration next week, where we're talking about this capability statement again.
Yes, and we would have workshops, a workshop led by people with lived experience who have been involved in the work that we've been doing, and we'll also have social workers from York City Council who have been involved as well in this work that we're doing, and they would lead a session on why relationships matter to people with lived experience, and then it would be followed by a number of presentations to really share the key messages and key learning from the work that we've been doing to develop the capability statement.
So that event's being held in London, and you can book on the BASWA website, but it would be great to see as many of you there as possible. I think it's time to sum up and thank everybody for all your contributions and for joining us tonight. I think from my perspective it's been a really helpful discussion to hear the things that have sprung to mind for you all at home when hearing about the capability statement. If you've got any questions or you'd like to follow up with us, Their contact details were shared earlier in the webinar and are also available on the BASWA website. I think all that's left to say is thank you and good night.
Thank you very much.